Okay, so today we're going to talk about the pro-inflammatory diet and Hashimoto. Inflammatory diets are one of the many triggers of Hashimoto's thyroid disease. And inflammatory foods are a lot of protein foods. It's meats and eggs and just a lot of things that are hard to digest, more or less. A lot of meat. And so grains are there. And this is not the intention of me, is to go through the whole pro-inflammatory diet, because the pro-inflammatory diet or the pro-anti-inflammatory diet is it was pretty much put together for autoimmune patients. And I think it was put together by Sarah Ballantyne, and it's one that's still used a lot. It's still used quite a bit for autoimmunity. Now, I'll make a caveat, and the reason that you want to follow a pro-inflammatory diet, and the reason I'm not getting into it, I mean, you can look pro-inflammatory diet up online, and you'll be anti-inflammatory, and you'll be reading for days, and there's different people who've put them together. But the original and the classic is the autoimmune paleo diet. That's the original anti-inflammatory diet, and I've used it for years, but I don't use it as much as I used to. The premise of it is correct. The premise of it is it takes out all the foods that creates inflammation in your system. 75% of your immune system, 70%, however much it is, depending on who you're reading, is in your intestines, and so it makes sense that if you have autoimmunity, you start dampening inflammation in your intestines, 75% of your immune system is there, you're going to start dampening immune inflammatory responses against your thyroid. Having said that, there's a little caveat in here. For me, about 70% of my patients come in and have something called small intestinal bacterial overgrowth. So, and that's a lot of my patients to have that. So if you go on the autoimmune paleo diet, then you will probably blow up. You'll probably start getting bloating and gas and distension if you are one of the people who have small intestinal bacterial overgrowth. So if you do that, then you need to know that you need to go to, at the very least, a low FODMAP diet. Another caveat is if you get on the autoimmune paleo diet and you don't seem to be doing well, and you're not bloating up, or even if you are bloating up, and if you haven't, and if you don't know your food sensitivities, of course, the autoimmune paleo diet removes all of your food sensitivities, and then eventually you're supposed to start reintroducing them. My experience has been that if it takes too long to reintroduce the foods, in other words, I introduce a food, and then I do that food for 3 days, and then if it doesn't react, I go to the next food. Depending on how many foods you are introducing, that can take a long time, so that can discourage people. If they have blow-ups along the way, like they have several times where they react to foods that they're still reactive to, those blow-ups for an autoimmune thyroid patient could be a couple of days. They could be a couple of weeks. So that can be a little bit of a hassle. And so so we know you have food sensitivities. That's why you do the autoimmune paleo diet, is to dampen those while you're able to treat. So you dampen the situation with the diet, and then the supplements that you're going to take, for whether it's for your digestive system or whether it's for your small intestinal bacterial overgrowth or whatever, are now going to work better. But the problem is if it takes too long for you to get foods reintroduced, your digestive system, which has got to be broken down for you to get small intestinal bacterial overgrowth, or for you to get the need to do an autoimmune paleo diet, your digestive system, even though you take that inflammatory response away, it still takes time for it to heal. And so if it takes too long to reintroduce your foods, you might start getting confused, because you might start getting new food sensitivities to the foods that you are now eating on the autoimmune paleo diet, because broken down digestion is what causes food sensitivities. So the dilemma, so that's a little bit of a dilemma there. In previous videos, up until maybe 3 years ago, I would recommend not doing food sensitivity testing because it was pretty unreliable. But over the last 3 years, over the last 3 years, food sensitivity has now pretty much gone full bore. Antibody testing, which is good, which is what it was not that before. So who was doing hair analysis and those types of things. So the testing procedures have gotten better. So I particularly like the Cyrex 10, and I like Vibrant company has a nice one that tests like 250 foods. And they seem to be consistently excellent to me. So I use those two depending on what's going on. So so anti-inflammatory diet, I would do today, what I do to help my patients to get through this more efficiently and effectively, and to not have this long string of months of reintroducing foods, is I am doing these food sensitivities right up front. Food sensitivities are one of the largest groups of triggers for Hashimoto's. So we get that right out of the way up front. Usually we'll use other diets. If the person has SIBO, if they have that oral tolerance issue, we might use a combination of those two diets. And then once we get that person, noticeably feeling better, their symptoms are a lot better, then we'll start reintroducing foods. And that's usually about 4 or 5 weeks in, maybe 6 weeks in, if they have SIBO, and it works out pretty well that way. So the introductions go a lot faster. The people get a lot better a lot faster. So when they have exacerbations from the reintroduction, they're not as bad, and it just really works out a lot better. But so the anti-inflammatory diet is a must. It's like a must. The diet is the best place to start because it calms everything down, and it allows everything to work better. You start to find out a lot of symptoms go away, and then you start to be able to understand your case by knowing, okay, that was diet. Those joint pains was diet. Okay, that fibromyalgia pain was diet, or that brain fog was diet. So it starts to allow you to really understand your case. I mean, I always start with diet. And that's it. So yeah, anti-inflammatory diet, huge trigger. I would argue maybe the largest, top five, one of the top 5 largest triggers for autoimmune thyroid disease.